Hello everyone, this is Cinta from the Institute of Health and Management. I have a special guest with me who has accomplished the Australian NCLEX-MCQ, which is the stage 1 for outcome-based assessment. Probably she would be the first set of students who have qualified the Australian MCQ. Welcome Raisa and congratulations.
Thank you, ma'am.
Raisa, can you please talk about your qualification and your experience as an RN?
I completed my BS in nursing. Later, I did my master's in nursing, and my subspecialty was medical and surgical nursing. And I did oncology as in detail. Then I started with my teaching profession. So, in the last 9 years, I'm working as an associate professor in India. To be frank, my actual journey started last year. So, I approached IHM for my EPQRN bridging course. Unfortunately, due to my personal circumstances, I was not able to continue with my bridging course, and I approached AFRA to continue with my OPA. So it took 4 months for the AFRA to give me a permission to go with OPA. So once I got the permission with the OPA, I started planning or preparing for the NCLEX. So from the month of February, I was preparing as in a casual way. Like 90-75 questions per day. It was just like understanding what exactly it is. So in the month of June, as I got the permission, I started preparing in an intensive way. I was spending about 11 hours. So it was in a detailed preparation covering up all the subjects. So there are a lot of subjects we need to cover up. So what we studied in our BSc nursing. So it took a long process to finish all them in time.
Many of our viewers will be really keen to know about your experience about NCLEX exam. So, how the exam day go for you?
To be frank, I was very nervous. It was my very first experience. So, I don't know how the pattern will be there for Australia compared to other countries. So, it is new to Australia. So, I was a little bit confused how it will be exactly the pattern it will be going there and how many questions actually we will be getting. So once I entered the exam hall, it was all new to me, and I got about 60 questions. Once I finished the 60 questions, the system has got shut down. They told me to just walk out. They didn't give me any information whether I passed, whether I failed. They told, contact your AFRA. AFRA will be sending you the exam results. That's what they said to me.
There are a lot of dilemmas around the Australian NCLEX-RN because it's very new. It of its kind in Australia, and also students are really confused about the duration and the number of questions or the types of questions they will have to face. Can you talk about that?
Only a few weeks back, they have changed a lot of pattern in this NCLEX. So the NCBN has recently made a lot of changes in it due to COVID cases, as they cut short the time duration to 6 hours to 4 hours. And the maximum hours they gave is 4 hours, and the minimum hours they gave is the 60 questions. But this means that you can do it in 4 hours, you can finish 60 questions, or you can go up to 130 questions. So 4 hours you have to finish 130 questions, and the minimum questions of 60 questions. Whether you pass or whether you fail, it depends upon the 60 questions. If you are in the borderline, they will continue with the 130 questions. But if you are below the borderline, the exam may stop with the 60 questions.
What are the type of questions you faced for your MCQ?
It is based on a multiple choice questions, but the multiple choice questions will be different in a different way. Sometimes you may be given a diagram, so you may be given a diagram and you will be asked to point out where exactly is the thing you need to show. And sometimes they may give you a graph, like ECG graph, and they will ask you which graph represents this disease condition. That will be there. Sometimes they will give you a lot of options, 5 to 6, 7 options. In that you need to select at least 5 options. And sometimes they will be giving only 4 options. You have to select 1 options. And some cases they will give you this audio where you will be hearing a lot of sounds. So 4 to 5 sounds they will play, and you have to identify exactly related to those disease conditions.
Is there any way your previous experience helped you to crack the Australian MCQ exam?
To be frank, to a certain extent, not completely, because my field was, I said earlier, the medical and surgical nursing. this NCLEX doesn't mean that it has only on medical and surgical nursing. It has different subjects. So different subject in a vast way we need to study. So it took for me even for intensive coaching, being an experience of 9 years, still it took me to take an intensive coaching to complete for this NCLEX-RN. Because what we study in India, what care we do in India is entirely different what we practice in US or in Australia or in other countries. So to gain the knowledge regarding the type of care that are practiced in other countries, we need to go for an intensive coaching.
So from your answer, what I have understood, even though a student or an international nurse has quite a bit of experience from their home country, you would really recommend them to go for an intensive training before they attempt their MCQ exam.
Yes, sure. Because that experience will work only for a certain extent, because all the question pattern what you see is not based on the Indian care aspect nor on the Indian disease conditions. So you need to know some more detail. There are a lot of things we need to know. So I feel that if they go for intensive coaching, knowing the other country's culture, other country's method of care they're providing to the patients, because as a registered nurse, the task and responsibility is high compared to Indian nurses, where they depend mostly on the doctors for the orders. Whereas when you come for abroad, the registered nurse is a whole and soul, where she takes the whole responsibility for her patients. So it is better that if they go for intensive coaching and learn completely in detail what exactly they expect from the foreign countries, from the nurses, this will be well and good, and they will be able to clear the exam at the earliest.
Right. On an average, how many hours you dedicated for your MCQ preparation today?
Earlier I said I started my preparation at February. I took only 1 or 2 hours for the preparation. But when I started preparing from the May, when I got the permission, I took for 9 hours. Intensively, I was sitting for 9 hours, and I was preparing for the exam.
Many students think that they can clear the NCLEX MCQ for the Australian registration by just relying on the online materials which is available in YouTube, or by doing the practice questions. So what is your opinion about that from your experience?
As for my opinion, there are a lot of apps in the YouTube, and as well there are many questionnaires where you can practice question. But to be frank, they only give you a light exposure. They're not giving you a detailed exposure. And what you practice there will not be the same thing what you write in your exam. So for that, you may need to go for an intensive coaching at least for a month or 3 months, where you will have a detailed preparation, because what we studied in India is different what we are writing the exam for NCLEX. NCLEX is mostly for where we are doing the work in US as a registered nurse, what they expect from a registered nurse. So to learn this, at least they need to go for a 3 months coaching, because the way of treatment, the way of nursing care is entirely different what we study and what we do in the hospitals. So it is better that if they can go with the very good coaching centers like IHM, where they can get a good results, where they can understand what exactly they need to study and what they expect to be in the exam. So it will be a new exposure for them.
Why do you think it is very essential to do an intensive preparation for the Australian MCQ?
Because it is new, as OBA is new to Australia. There is no particular pattern what you get, we don't know. So here we need to go for intensive coaching, because there will be different types of questions and different subjects we don't know. And mostly when you see that we need to have in-depth preparation, that is a thing. Not because we have a lot of apps in the YouTube, lot of questionnaires in the YouTube or in the Google software, or there are many books there. But one thing what we should know is that there will not be a single question. We cannot expect the same question in the exam. So the pattern of the exam is entirely different. The questions they ask is entirely different. So once you go for a coaching only, you will understand what you exactly to expect in the exam, how you can answer the question, because the questions are very, very tricky. And it is not as you go that if you see the question, I got the answer, because all the answers look similar. Sometimes all the answers look wrong. So you have to use your brain to choose the opt answer, and it takes time also. So So you need to have a practice. When you go for intensive coaching, you'll understand the subject clearly, to understand how to answer those questions in a tricky manner. Then only you'll be able to pass or clear this.
Excellent. So thank you for sharing some light in that area, Raisa. And before we wind up, what would be your advice to the future MCQ aspirants?
I would say that they have to prepare a lot, and to prepare a lot, it should not depend on any apps or anything. It's better that let them go for intensive coaching. Even they have a vast experience in the clinical side or in the teaching side, it doesn't matter. Let them have intensive coaching and complete their course in time, and let them go for the exam. So they will get a clear idea what to write in the exam.
Thank you, Raisa, for joining us today. And once again, congratulations and good luck for your ski. I hope this interview has really helped the future MCQ aspirants to get an insight about the Australian MCQ. Give us a call to learn more about IHM's NCAP OBA preparation. Probably you can be the next NCLEX MCQ superstar.